Hello everyone, welcome to SimSat Aesthetics. I am a professional esthetician and cosmetologist. In my previous video, I shared about indentification, home care and causes guide about Milia. But in this video, I will talk about the professional treatments, best for this. So watch complete video, as it's going to be best advice for you, and subscribe my channel. Section 6. Why you should not pop it at home. Attempting to pop Milia at home is highly discouraged due to significant risks. Milia are encapsulated cysts with no surface opening, unlike acne. Forcing them out requires traumatic pressure that damages the surrounding skin. This trauma can lead to permanent scarring and post-inflammatory hyperpigmentation. These dark spots and textural changes are often more noticeable and difficult to treat than the original Milia. Using non-sterile tools like needles or pins introduces bacteria deep into the skin. This can cause a serious infection, turning a minor cosmetic concern into a painful medical issue. DIY extraction often fails to remove the entire cyst sac. When the lining remains, the Milia is guaranteed to recur, typically with additional inflammation from the failed attempt. The delicate eye area, where Milia are common, is especially vulnerable. Aggressive picking can cause bruising, broken capillaries, and damage to the fragile skin. Professional treatment is the safe alternative. A dermatologist uses a sterile lancet to create a precise microincision, allowing for clean and complete removal of the entire Milia. This clinical method ensures immediate results with minimal discomfort. It eliminates the risk of infection, prevents recurrence, and avoids scarring, providing a definitive and safe solution. Section 7. The best and most effective treatments for Milia. Treatment is elective, as Milia are harmless. However, for cosmetic reasons, several highly effective options exist. Number 1. Professional medical extraction. This is the gold standard and most common treatment. A dermatologist or licensed esthetician will use a sterile lancet or needle to create a tiny incision in the skin over the Milia. They then use a cum-done extractor to apply even pressure and gently express the intact keratin pearl. This is quick, minimally invasive, and leaves no scar when performed correctly. Number 2. Chemical peels. Regular superficial chemical peels using alpha-hydroxy acids. AHAs like glycolic acid, or beta-hydroxy acids, BHA like salicylic acid, work by dissolving the glue that holds dead skin cells together. This promotes exfoliation, helps prevent new milia from forming, and can help bring existing milia closer to the surface for easier extraction. Number 3. Topical retinoids. Prescription-strength retinoids, like tretinoin, tazarotene, or adapalene, are vitamin A derivatives that dramatically accelerate skin cell turnover and exfoliation. Over time, this process can help to push the trapped keratin out of the skin. They are also a powerful preventative measure. In part 1 of this video, I told you about topicals which you can apply at home without prescription, but in this section I am telling you what needs doctor prescription. Number 4. Laser ablation. For multiple, stubborn, or hard-to-reach milia, lasers are an excellent option. An ablative laser, like a CO2 or erbium laser, precisely vaporizes the skin layer covering the milia, allowing the cyst to be removed or to fall out. This is highly precise with minimal damage to surrounding tissue. Number 5. Cryotherapy. This involves using liquid nitrogen to freeze and destroy the milia. The frozen skin and cyst will form a scab and fall off within a few days. This is more common for milia and plaque but can be used for individual bumps. Number 6. Diathermy, electrocautery. A small electric needle is used to heat and destroy the milia. This effectively burns off the top of the cyst, allowing the contents to be removed. Number 7. Deroofing, similar to extraction. The top of the milia is carefully sliced off with a sterile blade and the contents are flicked out with the tip of the needle. Section 8. The cost of milia removal. What to expect. The cost is highly variable and depends on the method, the number of milia, the provider's expertise, and your geographic location. Professional extraction is often the most affordable option, with a dermatologist or esthetician charging either a flat fee of $100 to $250 per session or a per milia cost of $25 to $75 per bump. For chemical peels, a single superficial treatment typically ranges from $100 to $300. Laser treatment is the most expensive option, costing between $200 to over $1,000 per session, based on the size of the area treated. Prescription topical retinoids can cost as little as $10 to $60 with insurance, but may exceed $100 without coverage. Procedures like cryotherapy or diathermy are generally priced per lesion, similar to extraction costs. It is essential to consult a board-certified dermatologist for an accurate diagnosis and a precise cost estimate tailored to your specific needs. Section 9. Answering your top Google queries on Milia. Question 1. How long does Milia last? Fact: for primary Milia in adults, they can be persistent and last for weeks, months, or even years if left untreated. They do not resolve on their own as easily as they do in newborns. Secondary Milia may fade once the underlying cause, e.g., stopping a heavy cream, is addressed, but often still require intervention. Question 2. Are Milia contagious? Fact: absolutely not. Milia are keratin cysts and are not caused by a virus, bacteria, or fungus. They cannot be spread from person to person or from one part of your body to another through contact. Question 3. Can diet cause Milia? Fact: there is no strong scientific evidence directly linking specific foods to the formation of Milia. However, overall skin health is influenced by diet. A diet high in processed foods and sugars may contribute to general skin inflammation and impaired healing, which could be an indirect factor. The primary causes remain topical and genetic. Section 10. When to see a doctor. You should schedule an appointment with a dermatologist if your milia are widespread or persistent despite using over-the-counter products. It is also essential to seek professional care if the bumps become red, painful, or inflamed, as this could indicate an infection. A consultation is necessary if you suspect you have milia and plaque or are concerned about an underlying medical condition. Finally, see a doctor if you want the milia removed safely and effectively to avoid scarring or other complications. This was all about milia. Watch its part 1 to know mechanism, science and home care. Like and share this video, and don't forget to subscribe.